everyone, so today we're going to be talking about the female general medical exam, so your routine physical exam that you should be getting about once a year. General physical exams for women are standard. It differs depending on your age, if you're 16. Having said that, we'll start off just doing a history, reviewing all of your medical systems, and we'll be asking about any medical problems you've had, any family history of medical problems, etc. I'll go over your medication, your past medical history, and your allergies to medication. After that, we will start the physical exam, and we will look at all of your different systems, including your vision, your skin, your teeth, your cardiovascular, your chest, your abdomen, your musculoskeletal structures. What's different for women is that we look at your breast tissue and we look at your gynecological structures. So we'll focus on that a little bit. When we do an evaluation of your breast tissue, we actually do an entire evaluation of both breasts. Okay. Now, what's important to know is that your breast actually extends all the way up into the axilla. So half of your breast or a quarter of your breast tissue is in the axilla, and that's the area where you get breast cancer first. So always remember to look there. Okay. If you have history of a primary relative having breast cancer, we have to make sure we're screening you 10 years before they got cancer. So if they got the breast cancer at 40, we'll be screening you at 30. Okay. What we're looking for with breast cancer is a hard, immobile mass that's not painful. Okay. So I'm pressing on it. It's not painful. I'm not able to move it, and it's hard and it feels like really kind of keratinous. Okay. So that's what cancer feels like. It might have irregular margins as well. A lot of young women have fibrocystic disease, so you might be feeling your breasts and feeling like you have fibrocysts like all over your breast. That's quite common. It has to do with dense breast tissue. Usually it's also associated with breast pain, heaviness, and fullness. It gets worse with your period, also with caffeine and chocolate. It gets worse as well. So we might just evaluate that as well if we need to, if that's something to look out for. We'll also look at how your breasts move with motion in different positions to see if there's any sign of scarring within the breast. The next thing we'll do is look at your gynecological structures. Okay, we'll do a pap smear first. The reason for that is cervical adenocarcinoma is higher with people who have been exposed to HPV virus. HPV virus is rampant. It's everywhere. I've seen it in millions and millions of people. Sometimes it's associated with genital warts, and sometimes it doesn't have any genital warts, so it's hard to tell. So if you're sexually active, we need to do your pap smear probably every year. If you've had 3 normal pap smears per year, we can go to every 2 years. If you're not sexually active, it's not as important to get a pap, but I mean, routine being routine, some people will just do it anyways. The incidence of cervical adenocarcinoma is highest in around age 60, but we still look out for it because it can be pretty aggressive. While we're doing the pap smear afterwards, we'll just take a swab for gonorrhea and chlamydia. The reason why is gonorrhea and chlamydia can cause inert infections of the uterus and vagina. And what happens if you have inert infections of the uterus, you can get uterine scarring and you can become impotent, meaning you can't carry a child. So that's really important for us to screen for gonorrhea and chlamydia. It might show nothing. Your boyfriend might have it, you might have it, you won't even know it. Okay. Then we'll feel the ovaries and we'll look for any masses or any pain. And then we'll feel for the position of the uterus to see if it's what position it's in. If it's retroflex, then we have to think about things like strong endometriosis and uterine scarring. So it's just an indication of what's going on for us. In terms of lab work, we'll be looking at your red blood cells to make sure they're carrying oxygen properly. We'll be looking at your white blood cells to make sure they're fighting infection. Look at your kidney function. If there's a problem with your liver, we'll look at your liver function. And we'll do all the other tests as indicated. And that basically is what the comprehensive medical female exam is for. It's really important. We don't like to miss things in people. Okay, take care.